Oregon has a mental health crisis, and we've reported how challenging it can be for someone with severe mental illness to get access to care. But there's a new reality that's developed over the last 5 years. The state, Oregon, has effectively criminalized severe mental illness, waiting for someone to commit a crime before they can be mandated to get treatment. It's created dangerous situations and calls for change. From his southwest Portland home, Hunter Graham watched the mental health of his son Austin go downhill.
He thought that they were poisoning the air and poisoning the water and were trying to kill him. At one point he thought somebody was hiding in the bushes in front and took a kitchen knife and went out to investigate. And so we were concerned.
Austin's parents first started noticing mental changes when Austin went to college. He couldn't finish his biomedical engineering degree and moved back home. After a bad fall, it got worse.
So it's been really hard to tell whether his struggles were from pre-existing mental illness or as a result of the concussion or a mix of both.
Last year, Austin started secluding himself in his room.
Rotting food and, poor hygiene.
Was he resistant to care?
Yes.
The Grahams needed help.
Immediately, we discovered, asking around, what you've discovered in your reporting, which is involuntary commitment is almost impossible.
Austin agreed to go to Kaiser's Brookside Center, a mental health hospital, but his stay didn't last long. He grabbed a nurse's badge and ran away from the locked unit, disappearing in the woods for 2 days.
There was going to be no way to break the cycle without medication. But we were told that it was unethical to medicate him in his current state because he wasn't in imminent danger to himself or others.
There was one route left: guardianship, a hard, expensive, and time-consuming process. The Grahams went to court, explaining how Austin was in immediate and serious danger, and his mental health was rapidly getting worse. A judge approved the guardianship in August, giving Austin's mom, Teresa, the power to consent to treatment. But even that is easier said than done.
He's 6'6", like me, and you just, even if you have the right to say you need to go to the hospital, if he refuses, then that's a significant logistic problem.
Even while under guardianship, doctors could observe Austin but couldn't force him to take medication. He didn't reach Oregon's high legal standards for involuntary treatment. Despite his psychosis, doctors said Austin was a low risk of harm to himself and others, and they sent him home with a plan.
My wife, in her wisdom, did not want him released because we knew he was going to fail. The behavioral health plan was set up to fail.
The plan did fail. Last October, while suffering a psychotic episode, Austin strangled his mother to death in their family home. Hunter Graham wasn't home at the time.
Unfortunately, the failure was that he killed her.
Initially, police saw no signs of foul play and didn't suspect Austin. 2 weeks later, Hunter was at the hospital with Austin when his son called 911.
He called police and confessed.
After police arrived, Austin wrote, "I killed my mom and strangled her with my bare hands," on the back of a sheet of paper.
Had you been worried about something like that, seeing your son's mental degradation?
We were concerned, but also relied on what the hospital evaluation was, that he was a low risk.
Teresa and Hunter Graham had been married for 33 years. She was an endocrinologist, a researcher helping people with diabetes and osteoporosis. She's described as having the rare combination of very high intellect with an even bigger heart.
I considered us very fortunate. She is a doctor. I'm a lawyer. We have resources. And even with all that, we failed spectacularly.
Police arrested Austin. He was charged with murder and is now being held and treated at the Oregon State Hospital after a judge found him mentally unfit for trial.
You shouldn't have to commit murder to get mental health care, but that's what our son Austin did to my beautiful wife, Teresa.
Hunter visits his son at the state hospital. Heartbreaking visits for many reasons.
With treatment, he's much better. I saw him yesterday in Salem, and the problem with being much better is he realizes what's happening and what's going on.
It feels to you that Oregon's system is designed to wait for something terrible to happen before getting someone care.
Treatment would have undoubtedly, in my mind, prevented this. She tried to take care of Austin and was still trying up until the end.
They've been abandoned by the state, and they've been forgotten about.
In Oregon, there are two ways a person with severe mental illness can be compelled to get long-term care. The first is through a process called civil commitment. That's where a patient can be involuntarily treated if they're found to be dangerous to themselves or others. The second path is through the criminal justice system. Someone commits a crime, gets arrested, and is later transferred from a jail to the state hospital for mandatory treatment. The problem is the first one, the hospital route, has all but vanished.
The system is failing to actually treat people within the non-criminal part of the system.
Oregon used to balance the types of people who could get help, some from medical referrals, others from the criminal justice system. But people in jail with severe mental illness were waiting far too long for care. And now in Oregon, being accused of a crime is effectively the only way to get mandated treatment. In 2019, a judge ordered the Oregon Health Authority to comply with a federal order and take jailed patients to the state hospital within 7 days. OHA started prioritizing criminal justice cases. These types of cases jumped to record numbers. But there are only so many beds. The health authority all but stopped admitting people who hadn't committed a crime. The data showing civil commitment in Oregon is nearly extinct. Melissa Eckstein is president of the Unity Center for Behavioral Health, a go-to source for mental health treatment in Portland. She says they used to send 400 people a year to the state hospital. Now it's just a handful.
Our treatment team is really put into a challenging situation because the things that they believe will help that person in having the most fulfilling life and being able to stay stable, they're not available to them.
Is there an option that's not the Oregon State Hospital, somewhere else you can send these patients?
Right now, there's really not.
KGW has shared these stories. Eric Gardner is now homeless after he couldn't get care. Kenny Benton couldn't recognize his own illness, only getting treatment after threatening his mom with a knife. Brett Meister was committed 4 times, but failed to get help after each release. The result is, people cycle in and out of local hospitals without lasting help. Hospitals that aren't designed to treat people with severe mental illness.
Taking up very vital, limited, community-based hospital beds.
4 of Oregon's largest hospital groups, Legacy, Providence, Peace Health, and St. Charles, sued the Oregon Health Authority, saying the state has failed to care for severely mentally ill people by neglecting civil commitments, instead warehousing people in acute care hospitals. A federal judge ruled against the hospital systems. They're now appealing that decision.
And it feels like every month that passes, we're just getting further into a hole.
Plus, Oregon increasingly stands alone. A study from the nonprofit Treatment Advocacy Center found Oregon uses just 7% of its mental health care beds for civil cases instead of criminal. That ranks last in the country out of any state that allows for civil commitment.
You are essentially creating a system where the only time that people receive care, it's in the most expensive, costly, and least effective setting.
Lisa Daly, executive director of the Treatment Advocacy Center, says we wouldn't tolerate this for any other type of health care. She asks, why should we with mental health?
If you create a situation where a person is not going to be eligible to receive care unless they have gotten into the criminal justice system, you're creating a system where care is predicated on the idea that there has to be a victim. I don't think that makes any sense, and I don't think most people would agree that they want that.
Jeff Rott and Kathy Shaughnessy reflect on more than 3 decades of marriage. Together they raised a son, now 29 years old.
He is the kindest, sweetest person.
They describe him as gentle.
We can't squash bugs in the house. We have to take him outside.
Which made his development of mental illness even more startling.
For us, it was just like, what do we do? It was completely blindsided, right? From the son that was studying for medical school to all of a sudden somebody is starting to disconnect from reality.
Jeff and Kathy's son was diagnosed with schizophrenia. They asked not to name him as he's getting better with care. His symptoms of psychosis started when he was in college. He'd hear things, say people were spying on him. One night he walked from Portland to Newburgh on the highway.
Because they think there's nothing wrong with them, right? They think they're just fine.
Jeff and Kathy felt lucky. During some psychotic episodes, their son agreed to stay in the hospital.
He would get to the ER. He would hopefully say the magic words, like, I'm thinking about killing myself. And they would put him into behavioral health, and then he would stay.
But if doctors decided he wasn't a danger to himself or others, and he turned down medication, by Oregon law, they couldn't force treatment. In 2019, Jeff and Kathy said a hospital released their son without warning, sending him on his way with a bus pass.
We had been there every day, his family, who were obviously going to be his caretakers, and they just let him go.
What happened next, they never expected.
We would track his phone. I woke up in the morning, looked at the map, and it was usually over here in Portland, and the map just slid over, and I was like, oh no, he was in New York. So you think about, was he dangerous to other people? He was in complete psychosis and got in an airplane. What do? He's in the city of millions and millions of people in psychosis, and he's in New York City knowing no one, with hallucinations that he's at Juilliard dance school, that he's a writer for Saturday Night Live, he's dating a supermodel who lives there. Luckily, they found him in New York.
Jeff and Kathy had called New York police. Officers found their son and took him to another hospital. He denied medication and treatment, but the New York facility held him anyway.
When you saw how this process worked in New York compared to Oregon, what do you take away from that?
New York really cared about him. I mean, that's the simplest way to put it.
Jeff remembers a nurse.
And she just kept telling me, don't worry, we'll get him back. And, whew. Oh, sorry.
The facility sent his son to mental health court, where lawyers and a judge discussed involuntary treatment.
And the judge would say, hey, if we give him this medication and give him time, is he going to return back to his normal life? And everybody said yes. And so the judge just said, he needs to take this medicine.
2 months after his son was admitted, Jeff Rott walked in on one of his daily visits, expecting the usual.
He wouldn't recognize me as who I was, and I walked in. And he said, hey, Dad.
In New York, that system, that treatment worked.
100%.
Oh, yeah.
New York law doesn't require imminent danger for forced treatment, a high bar that can be difficult to reach. New York also has more than 2,500 civil beds. In contrast, Oregon's civil commitment law requires imminent danger for a person to meet the grave disability requirement. The state currently has less than 50 civil beds and stopped admitting almost any civil patients to the state hospital over the last 5 years. The result? People with severe mental illness too often only get treatment after they commit a crime that sends them to jail. It's a process that shocks acute care hospital leaders.
If we really are listening to what people need and what is going to help them with their individual needs, we won't see people cycling back through an emergency room.
And family members who've experienced tragedy.
If he wasn't psychotic, he wouldn't have killed Teresa.
Oregon does recognize the problem. KGW's initial Uncommitted reporting series in 2022 helped spark a Judicial Department work group that spent the last 2 years studying Oregon's civil commitment laws. Heavy hitters like judges, advocates, and policymakers will recommend changes in June. Oregon lawmakers just approved $85 million to expand mental health and substance use facilities across the state. But based on current need, that's just a drop in the bucket. An Oregon Health Authority study found Oregon needs to add 3,000 residential treatment beds, or about 70% of its current capacity, over the next 5 years. That would cost an estimated $500 million, and it doesn't pay for running the facilities once the beds are available. Jeff Rott says he sees news stories where someone in a mental health crisis commits a serious crime.
And yet then the world will label that person a monster or this horrible piece of trash. And meanwhile, it could have been my son.
But he believes the way we currently do things in Oregon sets us up for failure.
We're the monsters. We didn't help this person. Collectively, we didn't help this person who needed help.